Is it a situation there, or people,
So
the public transportations have stopped?
yeah,
So most of them, how they are managing, how the healthcare workers are coming to the hospital?
public transports are not fully stopped actually. Some are running, and there is some provision in many places for the healthcare staff. For example, shops are very busy and they are getting empty. For example, on social side, by lunchtime most shops are totally empty. So there is a slot, 1 hour slot in the morning for NHS staff to go and buy those things, so that the healthcare staff can go about their business normally
Right.
without having to think about where to buy food. So
Okay.
those
And
provisions
are they
are being
using
made
the
as well.
mask everywhere, or you have a very specified set of instructions for the use of mask? Because otherwise, the mask would be out of stock pretty soon. How you guys are managing it?
You must have seen that there was a study that, or a letter that came out in a New England Journal 2 or 3 days ago on 18 March, I think, that talked about how long the virus or the aerosol can live on various surfaces. They talk about plastics and steel and copper and so on, and how long it lasts in air. The guideline here is you have to risk stratify. Not it's real life. Not everyone can have
Protection, yeah.
the absolute maximum PPE. Not that everyone needs it. So, for example, the guideline was that you might have 100 patients coming into the hospital and they are being suspected of COVID, and some of them are just needing normal oxygen. So if you go near them, you wear normal plastic gown and normal surgical mask, and you go them as long as they are
Okay.
not using any aerosol generating procedure. If they are using aerosol generating procedure, which includes NIV, high flow nasal oxygen, or obviously lots of suction or chest physio, then until the time that they are being diagnosed, the guideline is to use surgical mask. If you use any of the aerosol generating procedure or AGP, then no matter whether they have been diagnosed or they are just being suspected, you must wear full FFP3 or
And along
N95
with
mask.
the entire body suit
That's
and
the
everything.
guideline. And when they are diagnosed,
The standard, yeah, full precaution.
yeah, so
Yeah.
you wear the proper PPE if you are doing any AGP.
Only a
If you are
simple
not doing
surgical
AGP,
mask
it's not needed that much.
and a
But
gown,
at the point
gloves,
the
gown.
diagnosis is
Maybe.
certain,
Okay. One very
yeah,
sort of,
that's
because
right.
we have India have just
Yeah,
started
in
to manage
normal.
many patients put together, right? We have our experience also, but just to just to know from you, right? Is an this changeover of PPE, then your disposal of these PPEs and all these things, is it an issue or you have managed it well?
It's a major issue. It's a major issue that needs not only planning from the hospitals and the healthcare system, but also practicing by the staff. Donning or wearing the PPE is not that much of a big issue. You wear as you want, but there is a sequence to it. You wear the apron first, and then you wear the mask, and you wear the goggles, and then you wear the gloves. That's the donning sequence. And doffing sequence is you take the gloves off first, and then you take the apron, and then the goggles, and then last is the mask. So and doffing sequence is very important. What we have noticed is doffing can go wrong despite practicing. We practice donning and doffing for the whole of the critical care anesthetic staff on a Friday, not this one, the previous one. And what we are noticing is that to actually perform that in real life, it's a challenge. And therefore, what is suggested, and we are planning that, is to keep doing donning and doffing practicing. So even if you have done it a few times, doffing can go wrong. And if you, for example, touch the front of the gown, you are touching a totally soiled area, and therefore you will spread it to others. And therefore you must do it properly, and that doesn't come without practice. And the best thing is you do a buddying up procedure. When you don, your body watches you. When you doff, your body watches you and
You
stops you
said,
if you are doing something wrong.
correct me,
And therefore
or
practicing
enlighten
lots of
me this one
simulation.
more time. You said that the gloves off on the while your gloves comes first when you are doffing up, right? So it's a sequence. The gloves are off. The gloves
Yes,
are off.
absolutely, because that's the most
Then
important thing.
the gown from the back side very carefully. Then the goggles itself, and then the mask. And every
Yeah,
time we need to that we don't touch the
yeah, I'll
exterior
repeat. So
surface.
there is one more step. So every time you are taking the when you have taken the
Yeah,
gloves
yeah,
off, you
obviously.
must wash your hand with alcohol gel at least. You wash your hand properly and then do the next step. And it's important that the when it's what happens is the mask is also quite soiled equipment. When you take the mask off, ideally you should lean forward so that you can slowly take it off and let it fall off, rather than you do it in a way that when you take the mask off, there is a chance that the mask can touch the front of your face otherwise. So there is a particular body posture as well. You lean forward and then you take the mask off like that. And if you don't practice it, if someone is not watching, it's not going to happen. This is not something you routinely do, and people will get it wrong. People will get them infected
And
and
you
infect
dispose it
others
up
as well.
completely.
And there are lots of videos as well.
So
That
there is
goes in
no
the
question,
complete
because there are
disposal
certain
bin.
sort of suggestions which are sometimes practical but may not be scientific, that you can reuse some of the PPEs, right? So what is the take of NHS on that? Reuse PPEs.
There are certain masks that can be reused and that can be cleaned well, and they are not available everywhere. And therefore, at the moment, the policy is that you wear a mask each time you are going into an area. So, for example, if you are going in a total full COVID ICU, it's not needed that you change mask every half an hour. You keep the mask on for the length of the time you are going to be in ICU, that might be few hours, and take it out later on. That's okay. But if you are going into a side room and then coming out to a clean area, you must take it out, otherwise you are going to spread it. There is a problem everywhere, including here as well, and in Italy and everywhere in China as well, I believe, that the supply of PPE is a problem, and that's again real life. This disease has come on very quickly, and it didn't give any chance to prepare for millions of
Right.
PPEs to be manufactured in that short time. And sometimes the manufacturing is there, but supply chain has a problem. So
Not
maybe
being
there is a
available. Yeah.
million masks lying
Yeah,
somewhere, but
absolutely.
not in individual hospitals. But one has to be pragmatic about it and see how you can risk stratify. But what the staff shouldn't feel, which is us and the juniors and the nurses, that no one is thinking about it. As long as the management thinks about it seriously and communicates that we are trying our best and this is the safest approach possible that we believe can happen, then the staff gets confidence. Where it falls apart is if
And
the
you are
staff
left
feels that the management
on
is
your
not
own. Yeah.
bothering about